Hi, everyone. Welcome to HLA's webinar for chapter leaders, engaging the next generation, recruiting and supporting young adults in HLA chapters. We're just going to give folks a couple of minutes here to get on in, and then we will get started. I see folks coming in. Welcome, everyone. All right. Well, we're going to go ahead and get started. Welcome to today's HLA Chapter Leader Training webinar, Engaging the Next Generation, Recruiting and Supporting Young Adults with HLA Chapters, with our presenter, HLA Board Vice Chair, Zina Jawadi, and HLA Board Member, Michelle Frisbee. Thank you, everyone, for joining today. My name is Melissa Cruz. I'm HLA's Chapter Engagement Manager, and I'll be your host today. I'm going to start off by giving you some quick tech tips. To see captions in this webinar, we do have a live cart provider, and you'll want to click on the CC icon and click Show Subtitles. You can change the font size within the you can change the font size within the subtitle settings. The chat feature will be open for technical questions and for the panelists. If you have any questions for our presenters, please use the Q&A box. You can adjust your view by clicking on the gray bar within your screens to adjust the size of your side-by-side view. If you are looking at this on a tablet on your cell phone, you may need to scroll to get to your desired view. And just a quick disclaimer that HLA is providing this webinar as an educational webinar. We don't endorse any products that might be discussed, and it's just an opportunity to learn and share and grow as chapter leaders. So thank you for joining us today. And now I'm going to turn it over to Zina and Michelle. And welcome, Zina and Michelle, and thank you for being here.
Hi, by the way, we just received a message about some difficulty logging on, so just FYI. Hi, everyone. It's a pleasure to meet you all, and thank you so much for being here today. My hope is to give some ideas for your chapters on ways to recruit young adults. Let me just share my screen so you can see my slides. One moment. Let me know if you're unable to see my screen right now. If not, I will continue. Perfect. So just to give some flavor, I've estimated from various studies that America has about hundreds of thousands of students with significant hearing loss. And our goal is to connect and empower young adults with hearing loss through community, advocacy, and belonging. There are various challenges that we have seen across different chapters based on what I've heard from different leaders. One is that there are few young members who join, and the ones who do, often it's difficult to keep them engaged long term. Another challenge I hear is things like midday meeting conflicts with work or school schedules, which prevent people from being able to attend meetings, even if they were interested. And then even when some chapters have tried having evening and Sunday or Saturday morning meetings, the results around attendance are mixed. And so there's this challenge around like logistical availability combined with like just in general recruiting. And so my hope today is to present some ideas, some of which might help might be relevant for your chapters, and others may not. And it's just to share some ideas and what I've observed from my own experiences and from talking to others. First, I think it's important to actually decide whom are you trying to reach and what is your end goal. If your end goal is to try to recruit leaders, that would be different than if you're trying to recruit attendees. And that is the reason why I think those are actually two very important questions to ask yourself as you think about what your goals are and what next steps to take. So, for example, another way to think about it is, are you trying to recruit middle or high school students? Are you trying to reach college or graduate students, young professionals, professionals? Each of these are important populations, but there may be certain populations that you have the tools to currently recruit, or you may want to recruit for long-term sustainability. Whatever that goal is, it is something to keep in mind. In terms of clarifying the end goal, there are different ways you can try there are different goals you might have. For example, growing event participation, recruiting reliable new leaders, offer mentorship and support, even if they don't join your chapter. These are just some examples, but my point is that you want to figure out what your end goal is and then try to figure out what steps we'll take there. And that's how I personally would approach it. I think that using AI tools and online directories can be a really great way to identify local schools, disability offices, and relevant community programs. Within schools and universities, again, it depends on what population you're trying to reach. But if you're trying to reach people who are K to 12, I think the best way to do that is through public and private schools, special education departments, and school for the deaf. So many public schools, for example, have programs for students who have accommodations, and that can be a way to try to help target and do outreach. For example, my local public school here in Palo Alto is called Gun High, and they are known to have by the way, I'm seeing a lag on my end, so please let me know if there are any technical difficulties. But in Palo Alto, there is a public school called Gun High, and Gun High actually has resources specifically for people who have hearing loss. And that is an example of a way to do outreach. The other way, if you're looking for college students, is through disability offices. Some universities would be happy to share information to the specific population. So, and sometimes the policies change, so it may not be feasible. But for example, some universities know because they have the registered students who get accommodations. There are some who will have it documented specifically for hearing loss, and they have the medical letters. So these are documented cases of hearing loss, and they can forward that information to that population. Again, it depends on the school policy, so sometimes that's not allowed, but there's no harm in asking. Another way to do some outreach is through deaf clubs and programs. So, for example, UCLA has a deaf community or student organization, and that was actually founded by somebody who had hearing loss. Is actually now in Boston, but the person who did it is somebody who had hearing loss. So that's an example. And some of them don't have hearing loss, but they're interested in hearing loss for various reasons. Some are interested in sign language, some are have maybe a family member or a loved one who has hearing loss. So these are another example of doing outreach. At Stanford, there was an organization called Sense Connect, and those are just some examples of two that I'm just to give some examples, but there are others as well. There was a question asking, are we talking about young adults with hearing loss or families of people with hearing loss or hearing loss professionals? The answer is it depends on your population. In this case, I'm specifically showing examples if you're trying to do targeted outreach to specific people. So if you're trying to do people who are college grads or college students, I would go through the university disability office route or through some of the deaf clubs in those universities. If you're trying to do children who have hearing loss, I would go through the schools because the schools might be able to do outreach to the parents. I know there's some specific regulations. I would imagine there's specific regulations around minors, and so that's something I will defer to the HLAA team to give specifics around that because I don't know the exact answer. But that's just something uh to to get some context and examples. In terms of hearing loss professionals, there are ways to do that if you're trying to target, for example, physicians with hearing loss. So it actually is an organization called AMPHL. I'll put that in the chat. Let me make sure it goes to everyone. I am not sure if it's going to everyone, but it's AMPHL. That's American Medical Professionals with Hearing Loss. And those are people who are not just doctors, but nurses and anyone really, anyone in the medical field who has hearing loss. So that's just an example, but I would imagine there's an equivalent in law and some of these other major professional organizations. So that is an example of how to do targeted outreach to professionals with hearing loss to answer that question. In terms of the one other point about deaf programs, going back to the slide, is that there are certain community colleges and universities that have deaf studies or deaf programs. I will say oftentimes they do tend to focus on sign language, so I don't necessarily know if that's relevant for or the right population to target for your chapter because many of them don't necessarily have hearing loss. So for example, in the Bay Area, there's one college called Ohlone College, and they have some kind of deaf and deaf studies program, and that's a community. From what I understand, it's a college here in the Bay Area, which is where I live, and that's just an example of what I mean. Um, I am looking at the chat. There's a Kenneth, you said that did not show on chat question mark. I'm not sure if that's referring to Janine's comment or to my comment, but I'm happy to send a copy of the slides to those who have asked. Yes, it's AMPHL. I thank you for flagging. I'm not sure why it's not working on my side, but it's AMPHL. AMPHL. And then health and community networks are another way to do outreach. So audiologists in the local area, speech therapists, hospitals, including ENTs, DECARA, and parents helping parents. Again, it may not work because some of these do, from what I've heard from different leaders, it requires time and relationships with some of those with some of those offices to actually get them to to display our information. And sometimes there are reasons or restrictions, perhaps potentially from their larger institutions. So maybe certain restrictions that have nothing to do with us, but more to do with perhaps they're not allowed to share information about certain organizations for whatever reasons or policies that may exist. So sometimes it may not be feasible even if they want to, and I just want to acknowledge that. Tony, thank you for flagging. I will slow down. Feel free to tell me if I need to slow even further down. So, oops. The last category is the social media and newsletters. And there are different ways to do outreach. We do have a young adults here Facebook group. Admittedly, I feel like a lot of young adults don't really use Facebook anymore. They tend to be more active on Instagram, but that is our primary form of communication at the moment. Instagram's another way to do outreach, and that's a great way to get information from to spread the word to the community. And then one other platform is to go through local newspapers or LinkedIn groups. Some of the limitations here is some of the populations that you may want to do outreach to may not necessarily use those platforms. So it's just something to consider. So for example, I am not Gen Z, but Gen Z loves TikTok. Not everyone uses TikTok though. I don't even know how to upload a video to TikTok. So just as an example, Instagram, millennials do use Instagram. They don't really use Facebook. Like I have a Facebook that I check once every 6 months and realize that I have a whole bunch of notifications and I just can't get through them. So just an example to show that not everyone really uses every platform, but it's again like trying to figure out what population you're trying to do targeted outreach and use those specific platforms. And I really do believe that ChatGPT can help kind of figure out outreach. So for example, I think ChatGPT is really great at getting emails. So for example, if you're trying to figure out you want to do specific outreach to certain schools, it may know the specific email format that is used for that school, or it may be able to figure out how to get those emails in a faster way than if you had to do it manually. It's not always accurate. Take it with a grain of salt. Be diligent and careful, of course, but I think that it's actually pretty good at getting a nice list. If you want to do hospital outreach, it may even be able to give you some suggestions on who the right contacts are within the hospital. For example, somebody may think it's the ADA coordinator, but actually it may be some specific language department in the hospital that manages captioning and sign language. And that could be specific to that hospital, but those are just examples of really the goal is to get somebody in. Once they're in, you can kind of get the right contact. But It's just different ways of getting different contact information that you may not otherwise get. I'm going to pause here and see what other questions there are because I'm seeing several questions in the chat. I'm receiving a message. I answered the first one from BJ. The next one is asking the problem with locating deaf and hard of hearing students or adults is the HIPAA issue, not allowed to pinpoint who is disabled or share that information. So this is true, but I think there's a difference when somebody who has that information, first off, well, actually, let me backtrack. First off, for students, it's not HIPAA that applies. HIPAA is a healthcare and medical privacy law, but I completely understand where you're coming from. There's a different privacy regulation for students who are registered. But I'll give you an example that, for example, at Stanford, when I was, they don't do this anymore, but when I was in undergrad, because they have our emails, the disability office would forward the email. So we wouldn't be the ones getting their emails. The school would forward the emails to those who are registered with accommodations for their hearing loss. So that wouldn't be a breach of it wouldn't be a breach of the privacy law because you're not the one forwarding it. I hope that answers that question. I'm seeing some other questions here about churches are a great way. Exactly. Any religious the synagogue, mosque, it's the temples, etc. are all great ways to get information. I agree with that. And in fact, I believe there are some religious organizations. For example, uh the global, I think it's called Global Deaf for Muslims or something like that. There are organizations that exist. Great. Any more questions? Let's see. How about students from RIT or NTID in Rochester, New York? Yes, that's a huge program. Um, the person that there was a question in the chat around that. Yes, that is a large program. These are just examples in my specific area, but RIT, of course, has a very well-known documented program. So definitely that would apply. Okay, so I'm getting a follow-up around my comment around privacy, and it said it didn't fully answer my question. I've been told by people that it is difficult to find out who needs us and who is hearing impaired because it's a privacy thing. I I'm a little confused, admittedly, whether this is referring to schools or to hospitals. If it's to hospitals, the outreach would be different because the it would have to be the physician who tells their patients, and that requires like ongoing relationships with the local ear, nose, and throat doctors and family physicians. So for hospitals, it's a different process, and definitely privacy is one that of course applies. For adult clubs, I'm not sure what specifically you have in mind here, but in terms of the student organizations, the students are they oftentimes have mailing lists. So, for example, Sense Connect, the one at Stanford, has a mailing list. And that mailing list, they can forward information. Um, and then schools is the schools that what I was referring to as specifically the accommodation offices. But again, that's why I was saying it does depend on the school policies. Some schools will let you forward, will let the offices will forward information to students, and the students who want to apply will can apply. Um, I do have a lot of other slides, so I want to keep going, but I'm happy to answer questions offline related to that. And if anyone can reply to the message about RIT and NTID and the acronym, that would be great, just because I don't know how to apply to this. There was another one about at local schools, we go through the intermediate unit and have them notify interested harder students to contact us. That's a different way of saying what I'm trying to say. So I completely agree, Mike. So the next thing I wanted to go after, in addition to figuring out how to do specific outreach, I wanted to go back to actually show ways that you can help get people involved. There are different, and again, all of this depends on what your goal is. But I personally think one of the best ways to do outreach is to create ways for people to get involved and to address the needs of that community. So, for example, in California, many students in high school are actually required to they're actually required to do a certain number of volunteer hours. And what that means is that to graduate, they may need to do 10 or 20 or whatever number of hours to graduate. And volunteering in the Walk for Hearing or in a local chapter could be a form of not of hours because because we are a nonprofit. And so if we are able to get some kind of letter to support that student, in addition to doing outreach with HLAA, it's a great way for them to fulfill their hours, which is needed to graduate. And that can be a really nice way to get people to be exposed to HLAA at a young age. Perhaps they may not immediately stay involved, but at least they would have heard of our name. And in the future, they may choose to get involved again. It's a long-term relationship with all of these individuals and constituents. And so our goal is to do long-run recruiting. The next is to launch or promote a chapter scholarship. And some of chapters actually already have this. And I think this is a really nice way to recruit people because universities are expensive. Many people with hearing loss cannot afford the expenses associated with school, in addition to the additional expenses to have accommodations and, for example, hearing aids or certain technologies that may or may not be covered by their disability offices. And so a chapter scholarship can be a really wonderful way to introduce people to the organization. And because it's a very specific scholarship, only people who actually have hearing loss would qualify for those scholarships, or you can do whatever the scholarship, it's the chapter's decision. They may open it to others, but just it would be a very targeted outreach. And the nice thing is you now have a collection of names over the years, and that can be a really wonderful way to have a sustained relationship. So, for example, sometime I received the Silicon Valley Scholarship when I was in high school, and they've reached out several times to ask me to write an article or to share updates with the chapter. And that's just a nice way to stay in touch with the chapter. But imagine we can also expand it to not just our years, but to connect those individuals and the recipients of these scholarships together. So that can be another way to kind of get outreach while also addressing the need of the individual. Another idea that I had is to host career panels or social mixers on accessibility, technology, and advocacy. Admittedly, this one might require involvement of several chapters because that does require a lot of work, but many people with hearing loss struggle unfortunately, unemployment rates and underemployment rates are higher in the hearing loss population because of some of the barriers that exist for the community. And that one way to kind of help people get jobs is through networking and career panels. And so in addition to getting the word out, not just by the speakers who are presenting in these career panels, you're also getting those individuals introduced to HLA while also helping address a need that they may have. The last suggestion is to feature Walk for Hearing as a youth-friendly event. As we all know, Walk for Hearing has a wonderful community, and there are many families and children that come, and that can be another tool to kind of help get those families introduced to HLAA and to get individuals who are younger involved. I'm going to pause here to look at questions. I am having a hard time seeing all the questions while presenting. Please let me know if
And,
I need to slow it down further. Michelle, yeah.
Zina, quick question. Could you clarify when you talk about hosting career panels? Do you mean like inviting professionals in jobs or having, the HLAA leaders that have like a profession to talk about the profession? Or what exactly do you mean by career panel?
Yeah, it depends. So I think if somebody, I mean, Peninsula is a huge engineering hub, so I'll just use Peninsula as an example because I'm from the Peninsula area. The Peninsula area has a large tech hub, so there may be somebody who'd be happy to talk about their either what they did for a living or talk about kind of their journey and how they got to where they are and that could be one example. Another could be, and this one would probably admittedly need to be done more at a national or state level, which is to have networking events. So, for example, Lime Connect does recruiting for, helps try to recruit individuals, I want to say, who are college students to tech, but don't quote me on that. I don't think that's entirely correct what I just said, but Lime Connect is an example of an organization that tries to do outreach through internships. So there may be a way to do it through internship events, doing that like a networking panel or mixer, and that might need to be done virtually, or to try to connect individuals with different organizations. But again, I think for the local purposes of a chapter, I think it would make more sense to have people discussing their careers. I have to admit, I have not tested this in HLAA, so I don't necessarily know what that would look like for HLAA, but I think that it could be a really nice way of we have a huge network of incredible folks in our community, and many have very inspiring stories. And I think that can be a really great way to kind of help address some of the needs of some of our community within the community. So it's an idea, but I haven't necessarily tested it. So I just want to be transparent. Melissa.
And just two things. One, we do have an employment task force that is great and, obviously does webinars and things, but there are a lot of folks within that who I know would be willing to do presentations to chapters. So again, that's something, if your chapter is interested on something, specifically on employment, reach out to me and I can, potentially connect you with folks. I also wanted to, bring in Michelle. I know, Michelle, you do have a young adult chapter. What are some thoughts that, as what Zina's been talking about, what are some things that have worked with you, some of these different ideas that she's presenting?
Yeah, actually, we do have a chapter scholarship and a state scholarship, and so that offers a group of people to engage for young adults on past scholarship recipients. So we did set up a periodic Zoom meeting where we did invite past scholarship recipients to join in a kind of a networking Zoom environment. Because as we know, the young adults, especially during COVID, post-COVID, we all tend to lean towards some of the online activities. So anyway, we did try that. We're still struggling to keep the group engaged, meaning it started out strong and there was a lot of interest and there was participation. But as time went on, more and more people fell off. So it's been a struggle to keep that engaged. So that was just one other thing that we offered, an online Zoom group meeting, mainly for young adults.
Wonderful.
I just want to acknowledge that the Employment Task Force is amazing and they do host national employment webinars. So I don't mean any way, and I was involved with the initial formation of it. So no way am I trying to suggest we duplicate efforts, but there are a lot of contacts at the local level, and that's why I mentioned that. In
No, and
terms,
I absolutely agree. I just wanted to make sure that folks knew that that was a resource if they couldn't think of someone at their local level, that was certainly a resource of other, I want to provide as many resources as possible to our chapter leaders. So wanted to throw that out there as an additional resource that folks can use.
wonderful. In terms of engagement, I was going to get to this later, but engagement is an ongoing struggle. Frankly, not just for young adults, but just in general. And I think it's particularly challenging for young adults because as you transition to different stages of life, goals change, and it's not about HLAA, it's just the nature of the priorities in life changing. For example, sometimes people move, and so they're literally no longer in the area to attend chapters and meetings. So that is real. I think ultimately it's still a long-term goal. Like many of the people who were involved with forming young adults here we don't really meet anymore via Zoom, but we still message each other on chat. And to me, that's still a success because if we need something, we still have that contact and that group chat and we can follow up with one another. And I think that is what matters to me, is like that is a success, even if we don't actively go on Zoom anymore because of after COVID, things just changed, and that's okay. Many of them got married or have children or whatever the goals are that happen, and but we are all still in contact. And to me, I still think that's a success, even if we're not meeting via Zoom anymore. I still think that is a form of outreach, and many of them still hope to stay involved with HLAA in the long run. And so, even if they're not actively involved right now, it doesn't mean they won't in the future. So, I just wanted to call that out because there was a question related to that. I still can't see all the questions, so um, I will try to get to them later because I do have other slides, and I'm realizing that some of the questions are related to future slides, the next slides. So I next want to go into mentoring. I really do think that mentoring is a great way to help young adults envision long-term involvement. And that goes back to what I just said, which is recognizing that there are a diverse set of life stages. Two people can be the same age, but really have very different life experiences. One may be in college, another may be working, another may be pursuing graduate school, and each of those are their own set of experiences. And or somebody may be getting married versus trying to figure out what dating even looks like. And so I think being able to consider different topics and events that address these different needs are helpful. For example, I think maintaining friendships with healing loss or navigating relationships with healing loss is something that can attract many different people, not just young adults. Another thing that can be really useful is to connect young adults in your area with local resources. So, for example, there was an organization called the California Department of Rehabilitation, and they have many resources to try to keep people with healing loss employed. And so they try to help provide certain accommodations and and subsidies. So, for example, some of my classmates got their stethoscope. I have a mentor who got her stethoscope covered by I think it was covered by the Department of Rehabilitation. And so that is an example. And the reason it was covered is because this stethoscope has is amplified, and so she could hear with that, but she can't with like a standard stethoscope. So it's just to give an example of something that would be covered. Another way to do it is to feature young adults. So not just with speakers, but in local articles, asking them to write about themselves, recognizing some of their accomplishments. That can be a really nice way to not just help build content if you have a newsletter for your chapter, but also a nice way to kind of recognize the efforts of somebody who, frankly, sometimes a lot of people don't always get. It's really sad, but sometimes true. It's like hard to. People like to be appreciated. It's like a nice thing to be appreciated, and I would imagine that the young adults would really appreciate the recognition, especially when navigating young adulthood with hearing loss is very hard. Melissa.
I just wanted to say that Janine from our Eastern Connecticut chapter, I just got her newsletter, and she actually she has done that and has a young woman who's done a little piece for the newsletter, and it was, I think, very interesting. And I think that is a way to get folks involved, is to have them do things like that. So shout out to Janine.
That's amazing, and thank you for giving the shout out. That's amazing, Janine. Thank you for that. It's wonderful. I do see these other questions. I do have a lot of thoughts, but I also want to make sure I get through the slides. I'm happy to stop at some point if you would prefer for me to answer the questions, though. Melissa, do you prefer for me to keep going or to answer the questions first?
Why don't you keep going, and then we can actually, get the questions together if there are any that you don't answer, and maybe address them when we send out the copy of the recording.
I think that sounds great. The next part that I wanted to mention is supporting and retaining young leaders. This is something that is a challenge, and I think in general, not just with anyone with young adults with hearing loss, but really young adults in general. I think there are different ways to help with retaining individuals. One is to start small and involve gradually. Maybe the best way to get them involved is to ask them to manage a social media post. Or if they like Instagram, maybe they want to just run the chapter's Instagram. Whatever that looks like for that person, ultimately it depends on that person. That can be a lovely way to get somebody involved in a small way. And perhaps they don't attend chapter meetings, but that can be a really wonderful way to still keep them engaged, even if they're unable to attend chapter meetings. Another one is to give ownership. And this can have different forms based on the person and how they are. It could be asking them to write an article, um, inviting them to give a presentation, leading a social event, whatever that looks like. I think that can be another wonderful way to give ownership. Um, and that can be a nice way to help also see how it is. Is it a good fit for your chapter from a leadership perspective? That these are just examples of ways to get somebody involved without perhaps being overwhelming for them. And the third, which I mentioned already, is to highlight contributions publicly. There are some common challenges, which at least I think common challenges, and one of them is barriers to engagement. Sometimes the issues are transportation. Like, for example, if someone's a minor, actually physically getting to the chapter meeting. There may be ways around it, but might not be logistically feasible for the chapter. For example, having a Zoom app option. But frankly, maybe it's better to have a group chat that they can stay engaged in that way. It doesn't necessarily need to be in traditional ways to keep somebody engaged and active in a chapter. And I think that some of these might be just logistical barriers because of parental consent or transportation, but I just also want to acknowledge there might be workarounds, even things like offline communication. And I mentioned this earlier, but age is not the same as life stage. And I really do think that even for myself, the experiences that I'm currently having are very different from many other people my same age. And I think that that concept around age and not life stage not necessarily being the same is something that I've really come to appreciate in the last few years. And the last is turnover will happen. It's unfortunate to say, but it can happen. Um, that short-term engagement, though, is still important. Even if they showed up to one meeting, I still think that's a success. Perhaps they may not come right now, but what if in 30 years they come back and they said, "Oh yeah, I remember this chapter meeting I attended many years ago." That one meeting could still have a significant role in their life. Whether they come back or not, that is still important. And I think it is important to recognize that while it can feel sad to not have that long-term engagement, I still think that short-term engagement is a success. And one thing I've also noticed in general, especially amongst young adults, is that in-person RSVPs are historically low, even if there's strong interest online. Let me get to the next one. I think the next part for me is reframing young adult recruitment, supporting transitions. Each person's path to adulthood is different. Some may be in school, some may want independence or identity, figuring out their identities or work. It's different for each person. And I think helping them navigate that transition can be really valuable. And we've touched upon some of these already, but that can be including community building, mentorship and career guidance, and tools for self-advocacy and tech navigation. Is my pace okay right now because I'm unable to see the group chat? Maybe Michelle, if you can tell me how my pace is, because I can't see anyone right now. I just want to make sure I'm speaking at a good pace for folks. Okay, I'm assuming that the silence means it's that my pace is okay, or do I need to slow down?
There's still a few questions in there, but yeah, the pace might still be a little fast.
Still fast? Okay, I'll try to slow down more. Please feel free to interrupt if I need to slow down more. I think there was a question somewhere about measuring progress. I think it again depends on the chapter, but for me, I think measuring it isn't helpful to measure progress to track what is working, what is refining outreach, and demonstrating impact. So for me, the different metrics that can be used. For example, you can track the number of young adult attendees per event. You can track repeat attendance and volunteer engagement. You can track social media reach through followers and post engagement, and you can also track new member signups per quarter. So just some examples of what measures can be used, but those are just some that come to mind, both to track recruitment, but also engagement as well. You can also conduct a short post-event survey and ask, how did you hear about us? Or how did you hear about this event? And that can be a nice way to also see what is working. It could be a multiple choice option, select all that applies, or just a simple box, whatever works for your chapter. But it's just something else to consider that that might also be a way to track what's working and what's not. I just wanted to share an experience that I had many years ago in trying to conduct a Bay Area outreach event in 2013. At the time, I was in high school and had recently become involved with HLAA and I wanted to have a young adult event in my area. I reached out to hundreds, like easily 100 schools, and very few people RSVP'd. I sent emails through like official press releases. I used social media, peer networks. I ultimately found that we did have a good turnout, more than actually more than the number of RSVPs. But I think the things that worked for us was the social media and the deaf program that in the area had a couple of attendees. But it was frankly, it was a bit random. It didn't feel like there was a clear trend, but I did see some interest. And in fact, somebody I met years later who actually became involved with the HLAA Young Adults Here event told me he heard about the event, but he couldn't make it that day. But he did know about it. So word went around, even if turnout wasn't as great as I would have liked. But I still think it was a success because those individuals got to learn about HLAA. Another way to kind of help retain some of these individuals who attend, and some of the ways I did, is to do personalized follow-up. So if somebody comes to an event, you can send a follow-up email saying, thank you for coming, and ask more about them. So for example, in the context of my first chapter meeting was in HLAA LA. I actually I'm not from LA, but I was in LA for a summer internship, and my mentor told me about HLAA LA. And so I went to the chapter meeting, and Grace Thiessen was the person who kind of followed up with me. She met with me one-on-one. She encouraged me to get involved with the state organization, and that's how I ended up getting involved with the state board. And years later, I'm obviously still very active with the organization. But just to give you an example of something that worked for me, I think Grace's follow up with me and the care that she had, not just for with the commitment she had in mentoring me and getting me involved with HLAA, but also with her deep commitment with the HLAACA organization, HLAA as well as the state newsletter. So it's just some examples of how personalized follow-up has been successful, at least for me. And just wanted to mention, I touched upon this earlier, but we formed in 2020 a group called Team Young Adults Here. It's an online group. We used to have recurring Zoom meetings, but we actually stopped because everyone was in different stages. But it's a very successful group of individuals, and we clicked as a group. I think part of the reason it worked is because I formed it using my own personal network based on people I knew had common goals, similar professional backgrounds, and similar stages of life. So I just wanted to share the picture of the group. And many of them have PhDs, MBAs, law, not law, actually, we don't have a lawyer in the picture, but PhDs, audiologists, MDs. It's a very successful group of individuals. And so I just wanted to recognize that I think part of the reason it was successful for us is we were in like various stages of life, but similar stages. So, for example, I was applying to medical. I actually, excuse me, I had already been admitted to medical school, and one other person was currently in medical school. There was somebody who was finishing up his PhD while someone else was doing her postdoc, and just a nice way to kind of get people who have similar niche interests, but also passionate about hearing loss and have similar backgrounds. So it's just something to kind of show a flavor, a different side and flavor of what I think worked for us. Even if we're not currently as active as we were back then, that group chat is still used, even 5 years later. So it's just something to show. And that was a national group, it wasn't a local group, just to clarify that. I think somebody asked me, why did you want to get involved with the organization beyond your mentor recommending you do so? Maybe I should clarify that my mentor told me about HLAA because I was interested in hearing loss advocacy. I was in high school. I didn't necessarily know how to kind of become active in hearing loss advocacy, But for me, I was very interested in that, and I didn't necessarily know how. And that internship was at House Research Institute, which was the premier ear institute at the time for research. And my mentor himself had cochlear implants. And so, in addition to mentoring me in the scientific front, he had mentioned HLAA to me because I was passionate about and interested in getting involved with advocacy. And he thought that was a really great way for me to get involved. So I would say that was the biggest reason. I don't necessarily know how to say that any other way, but I think it was the reason the mentor told me about it is because it was something I was trying to do and get more involved with. And so it was a means of doing something I wanted to do. I don't know if that answered your question, but I stayed involved because I really loved the community and I didn't know anyone with hearing loss. And it was the first time I got to be exposed to so many people who had hearing loss and who were just as passionate and committed to making this world a better place for people with hearing loss. So that's why I stayed. But the initial reason I got involved was because of that. Michelle.
Hey, can I just chime in here quickly? Yeah, Zina, that's wonderful. I would say you're probably unique as a young adult. Most probably are not ready at that point for advocacy, So unfortunately, we have to find a way to, reach out to them and engage them especially if they're not, ready at that point yet. I will say also that I was your comments spoke to me about, reaching people at the different stages. And I think we just need to keep in mind that even if the young adults aren't coming to our meetings, if they are included on our newsletters or our social media, I think we should assume, hopefully, that they are seeing our posts or reading our newsletters, and maybe that information is helping them, and maybe they're just not at a point where they're ready to engage. Myself, personal example, I heard about HLAA from an ENT or audiologist back in my 20s, many years ago, and I got involved when I was in my early 20s as a young professional and struggling with hearing aids and hearing loss. But then I was married and I started having children, busy professional. So I then became uninvolved. But I still got the newsletter for all of those years and I still got very helpful information. Then, when I was ready to get a cochlear implant, HLAA was there. I had been getting all their newsletters. I went to some conventions and it helped me at the various stages is what I'm trying to say when I needed that help. And then I went away again for a while, meaning not active involvement as I was a young professional and busy and married and raising children. And then later in life, as my personal work time, allowed me to commit more time, then I became more involved again and, as a leader and advocating and on the boards and stuff. So, yes, we need to meet people where they are in their journey.
I think that was beautifully said. I had a follow-up comment to it, but now I don't remember my follow-up comment. That's okay. Um, the next I guess I presented a slide to Peninsula chapter, but it applies to really any chapter. And that is what has worked for your chapter in the past? What outreach methods have worked best for your chapter? How can we collaborate statewide and nationally to share resources and contacts? And if the goal is to recruit future leaders, would it be more strategic to focus on another population? As much as I think it's extremely important to support young adults in their journey in a very difficult period of their life, perhaps if your goal is to recruit leaders, maybe that isn't the right population for your chapter. And it's just something to consider that they're not mutually exclusive. You can try to do outreach to young adults, but also try to be focusing on recruiting future leaders elsewhere. I don't know what that looks like for each chapter. Frankly, it just depends, but it's just something I had to acknowledge. I think it's important to say it's okay that maybe that's not the right population for us at this point in time. So I did see a comment I wanted to address. The comment was that maybe there was not a need for involvement with HLAA. It says the younger generation grew up with the ADA and more access to technology and information. Some of them may not feel the need to connect with HLAA for any support or help. Since this age of Google, you can find information on your own. While it's true that Google exists and those resources exist, I actually think a lot of people really struggle with hearing loss. And I think that many of them, I have a lot of people come to me all the time actually asking, it's almost like this experience of being able to share their story, like imprinting on somebody else. I don't know what the right word is, but sharing their life story with someone who gets it. I think that concept of sitting by yourself in the cafeteria doesn't really change. I don't think that the ADA, as much as the ADA has transformed and is a necessary law, and we need so much more beyond the ADA, I think there's so many barriers that I don't think that HLA is still needed more now than ever from the young adults perspective. So there was a question, by the way, at some point asking how do we define young adult with hearing loss? I did have one slide on that, so maybe I'll just share. This is my last slide, and then I'll go back to sharing my screen. I can't share it if you can share it, but there we go. Perfect. It's just the last slide I wanted to mention is that I define young adult or adulting with hearing loss as navigating that transition to adulthood. I don't think there should be an age range because of the reasons I said related to transitions and stages of life. I think each person has a vastly different experience, but to me, it's that transition to adulthood. For some people, that finishes early on, perhaps in their 20s. For others, they may be 40 and finally feeling like an adult. But to me, I don't think the age range is what matter. I think it's the experience of that transition period. So that's how I personally define it. I'm sure that's up for discussion amongst others, but then when the young adults here group was trying to figure out what our definition was, the Team Yeah group that I referenced, this was the definition we used. So I just wanted to share that slide in case it's helpful. Okay. I am seeing quite a few questions, so I will try to get through as many of them. But Michelle, before that, do you have anything else you wanted to add?
I did have just a couple additional points to kind of like add to some of the comments you made. And one is regarding the scholarships. I did answer one of the questions in the Q&A. If people were wondering what type of scholarships, look in the answers. That ours are tuition based for mainly high school students going on to secondary education. A student with hearing loss can apply for a scholarship toward college or secondary tuition. Then also, very importantly, if you're going to start a scholarship like that, it's best to include a requirement in the application to say that, a condition of the scholarship is some type of give back to HLAA, either them coming and presenting or preparing a newsletter article or sharing or posting something on social media. So that is very helpful. Then the other thing I wanted to mention is just, it's not really a suggestion, more than just a comment, observation that all of these things, I agree with everything Zina is saying. Such good information, helpful tips. Another thing we struggle with at the chapter level is having people willing and having time and taking initiative to do all these things. So that's where we struggle as chapter leaders. I think, we're already spread so thin. How can we add more to our plate? So maybe this is, maybe we could have another follow-up, about how to engage more leaders and helpers and volunteers so that we can delegate some of this stuff to other people to help do a lot of these activities.
Michelle, I definitely agree with that. And I like your idea of doing a follow up webinar on just engaging more leadership. I do think one of the things that we've seen with some of the chapters that have been very successful at growing and mentoring is, kind of finding people where they are and what they're interested in, and then engaging them. So like Zina was talking about, like the social media, that's something that I know a lot of the chapter leaders struggle to find time for and things, but it's something that, kind of the younger adults do on a regular basis from their phones, wherever. So, kind of realizing like, hey, this might be a way to not only engage someone, but also take a little bit of a burden off of myself, as a chapter leader. And so kind of finding those things and finding places where people are interested in. Another thing too, and I've mentioned this before to other chapter leaders, is a lot of times colleges have programs on like social media, communications, things like that, that require internship hours or volunteer hours. And that certainly to look at your colleges around you and reach out to them and, reach out to the communications department and say, hey, we're a nonprofit. We could use help with social media or video or different things like that. Do you have students who either want to build a portfolio, need to get so many hours, et cetera? And that's a great way to get that, some of those needs met. And it doesn't even have to be just the communications piece. It could be things like building a website. Is there, a computer, technology major that, they could use some help, or again, would like to have a portfolio piece that you can reach out to.
I agree with everything that was said. I don't know if this is helpful or not, but I guess one thought I have, it's just part of the reason why I started my first slides was to say figure out what your goal is first, is to figure out what will work and what will not. I shared a whole bunch of ideas. If to do all of them at once would be, I would get overwhelmed. Even the idea of that would be overwhelming for me. I think to me what works is maybe start with one thing. What is one thing that can be done that will make it, that can help? Of the ideas, whether it's from today's session or something else, what is something that has worked in the past that you could try again? Or what is something you can experiment with? Just one thing with a timeline of, say, 4 months. I made up that number. Sometimes like having just one thing makes it feel a lot more manageable than trying to do many different things at once. And the other advantage is if you do one thing at a time, you kind of also have a clearer answer of what works and what doesn't. Because if you try many things, you don't necessarily, like with the event that I had, I don't necessarily know what worked and what didn't. I know some things didn't work, but I don't necessarily know all the things that did work. There may have been some forms of other outreach that happened that contributed to some of the attendance. So it's just something to call out that sometimes there is an advantage and something to be said about just doing one thing at a time. I remembered what I was going to say earlier, Michelle, and that is that I completely agree about attendance could be through reading the newsletter because I know that I couldn't attend chapter meetings. And if you were to track my chapter meeting attendance, it wouldn't be great because I had school for most of it. So just something to mention that I think I'm fairly engaged, but if you were to track it purely based on chapter meeting attendance, it would be pretty bad attendance on my part because I had school or work. So.
Well, thank you guys. Thank you, Zina. Thank you, Michelle. Thank you, Lisa, our captioner. We're at the end of our hour, but we will be pulling the Q&A, and Zina, I'll work with you to try and get answers to those and what we've already answered. And when we send out the recording, we'll also include the presentation as well as the Q&A that we've gotten and that we will get the answers to. So thank you, everybody, for joining us, and hopefully this was helpful. And I really appreciate Zina and Michelle for participating and doing this with us today. So
Happy to. I'm happy to stay on if people have additional questions. I intentionally left time after, but I don't know I'm happy to send out a different Zoom link if it would be helpful for people who have questions.
Not sure if Lisa can stay on.
Oh, right. Okay. Yes. Feel free to, I'm happy to send a Zoom link. It will not have official captioning though.
Yeah.
And I'm able to stay on for a bit too, if anybody wants to. I don't know if you have to end the official webinar and then
I
do
can
it
leave
differently or not.
I I can certainly leave it on here. I just think Lisa may need to drop, but we can certainly just go to the the regular, um, the non
The Zoom captions.
exactly the Zoom captions.
Yeah.
So
And I'd be interested in hearing from anyone who has tried like a high school or college student like intern, to help them either with social media or technology or whatever. That's one thing we've considered, but we just haven't found the time to research and implement that yet.
um, I'm not sure. I know that some of the chapters have done that. I believe the Boston chapter has someone helping with some stuff. I think again, Janine may have uh, have had some folks helping her with that as well. Um, and then, like I said, I know that certain colleges do. My daughter recently graduated, and she was actually a social media and digital marketing major, and they had to do so many hours of outside, um, production to for graduation. So again, that's a lot of times that's a requirement for students. So it's a great way to maybe help your community and get the things. We do have some questions in the chat that have not been in the Q&A that have not been.
Melissa, if you could actually look at the question from Christine in the Q&A, because I know Michelle was actually curious about the answer too. Zina, if you see the suggestion question about getting audiology students involved in HLAA.
Let me read the question aloud for the purposes of the webinar. The question is, what are your suggestions about getting audiology students involved in HLAA? We have 2 colleges of audiology in Wisconsin, but thus far have not been successful. Invited to state conferences, nobody came. Could students do coursework focusing on HLAA? That is a great question. I'm actually thinking that Kelly Tremblay would be a really great person to talk to about this because
Oh,
Kelly has an audiology background. She was on the HLAA board and she teaches students who have audiology students. So I'm actually wondering if she would have a really interesting perspective because I am not an audiologist. Um, let me just find the question because I lost it. I think for me, there are different options. One is audiology, I would imagine the program has courses. I'm wondering if one of the courses can be somebody who has, if somebody would be able to invite one of the chapter leaders to present their story, their hearing loss story, and talk about HLAA in that presentation. Because in medical school, I say this because in medical school, there was a lecture on hearing loss, and then I volunteered to present about my own experiences with hearing loss, and of course I mentioned HLAA in that presentation. So I would imagine that would be relevant for the purposes of audiology. I would also imagine that an organization like ASHA, I remember with HLAA I think we collaborated with them, or like we participated in their fair, they participated in our tech expo, and so that's just another way to potentially
yeah.
get some involvement. Michelle, excuse me, I think you had your hand.
Yeah, I just wanted to add on to that because Christine is on our chapter and state board also, and so I share her question issue in that we have tried to partner or collaborate more with one of the universities nearby and have not been very successful, unfortunately. And one of the young adults that we did have involved in our periodic Zoom meetings, initially, she's one of the ones that was very gung-ho and interested, and she was actually going to school at this college. And we had connected about having us, a member of HLAA, go present for their student. It's a long abbreviation, another acronym, like the Student Association of Hearing Speech Pathology, blah, 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 something. I don't know. And we talked about that back and forth. We were gonna do it, and then I invited, we were hoping to make a connection with the college, and then have them maybe come present to us as well. Long story short, that student kind of fell off the radar, and she stopped going to that school and went to her local community college, and I never heard from her again, even though I reached out 3 or 4 times. So this is part of the, difficulty in keeping them engaged, and then also in trying to make connections at these other hearing healthcare facilities.
I'm sorry to hear that. I guess
Yeah.
one question I have is the audiology, when you said you reached out to the college, how did you reach out? Was it through the school or was it through one of the faculty?
I wasn't involved in the past. Actually, Christine, if she's able to make more comments, she could maybe comment on that. But we're starting to possibly reach out to them again because we started to have some conversation about finding a venue for our next state conference. So there's
Yeah,
additional dialogue with the professors going on with that right now.
yeah. I was asking because I wonder if you might have more success reaching out to specific faculty who does teach a course in the program. Ideally, one that teaches like a mandatory course for all students. But even if it's just 1 or 2 classes and it's not everyone, it's still a win is a win. So
Yeah.
I'm just wondering if a different outreach within the program might help. I don't know
Yeah,
the
I think they had reached out to professors years ago or somebody as part of the communicative disorders department. Um, but I don't know exactly what happened. And now we're trying to build that relationship again or connect with maybe new people on board.
I hope it works out. Happy to talk offline because it sounds like it was an ongoing conversation. Happy to talk offline. Melissa, were there other questions? Also, did I answer that question? I want to make sure I answered the question to the.
Yes, I think you did. I think looking through, people are just kind of putting.
There's a couple comments from BJ that I'd like to just comment on, which are good suggestions about, even collaborating with other disability organizations. I know that can sometimes be helpful because often someone with disabilities has multiple disabilities. So that can be helpful. And then also she said, um, working with a student who's co-editor of their school paper, asking them to start a monthly column about people with disabilities. Great idea.
I
That
agree.
is. And Christine said that they drop off their annual poster at their audiology school. Ken mentioned that they do outreach at health fairs, school community fairs, Section 8 outreach events. Andrew said that there's a club in Chicago called CDS, Chicago Deaf Seniors. It has 220 members, but they're using ASL. Would they fit into HLAA? I certainly do know that some of our chapters do have a large membership of folks who are using primarily ASL. I think it kind of depends on the chapter and what your who is part of your chapter, but that's certainly something to reach out and talk to them about. So because there are chapters that have a strong mix, and then there's some that are primarily folks who are not using ASL. So it's just kind of, it really is whatever works with the chapter. Looking through.
Questions. I think there was a question around scholarships and what that actually entailed. Um, the there were different forms of scholarships that obviously HLAA has. I think the ones that I was specifically referring to were scholarships to help students in their education. But ultimately, the chapters can choose what they want to do. If then maybe that's not how they want to use the scholarship. Maybe the scholarship is to help fund someone's hearing aid. That's of course a bigger expense, but or maybe a technology. One of their fund to donate or give away a technology there might be other ways. This is just an example that I'm making up. Another could be to help fund someone to go to the to go to either a state convention or the national convention. So ultimately, that depends on what the chapter is looking for. I was specifically referring to scholarships, and the Silicon Valley one was high school to college. But there are scholarships that exist to help students get into grad school. But I don't think those are specifically involved with H. I don't think those are specific to human loss. Any other questions?
I just had another comment about somewhat related to the universities where they have training with audiology. I also want to say, yeah, the speech language pathology area is another good connection. And one other area that we're hoping to engage in programs next year, maybe regarding some of these students that are in our young adult group that may or may not have received a scholarship in the past. And we were able to connect with the ones who not necessarily received the scholarship, but even the applicants. So we have a pool of people who, are all the applicants, and we tell them to share it with their friends or contacts, anyway, or relatives. But what I was going to get at is uh, the recent graduates then, now that are going into those audiology or speech pathology careers, they would be a good one to pull in on a panel. Or, when Zina mentioned having the young adult speakers, we always tend to, a lot of the hearing healthcare topics that relate to speakers are often older presenters. So just by shifting that to a younger presenter might help bring in that younger population.
Yeah, I think all of these are really great ideas. We're now at 5:15, so we probably should go ahead and end the webinar. But thank you, Zina and Michelle. And Zina, would you mind sending me your PowerPoint? We've already gotten a couple of requests to share it, and someone was actually looking to hopefully share it with their board tomorrow night. So if you don't mind sending it to me after this, that would be wonderful.
Absolutely.
So thank you guys, and thank you to all our participants. And like I said, this was recorded, and we will be sharing this along with the Q&A afterwards. Thank you all.
Thank you.
Night.